Medication Administration Part 2. Let's talk about intradermal injections. The amount that is injected is usually going to be 0.01 to 0.1 ml, usually using a TB syringe. You're going to inject just under the skin. In other words, slip the bevel under the skin at a very, very small angle, and as soon as the bevel is underneath the skin, you've injected the needle far enough. You're going to inject the solution. You want to see a bleb form. And if you look at the picture on your slide, that little round circle on the patient's arm is a bleb. That's the medication just under the skin. Common intradermal medications will be TB, skin tests, and allergy testing. Subcutaneous injections are going to be like your insulin, your heparin, your Lovenox. These medications are going to be absorbed more slowly than they will if they're injected intramuscularly. You will inject 1 to 2 mLs, going in at a 45 to a 90 degree angle insertion, depending on the body size. If you can pinch up 2 inches, you go in at 90 degrees. If you can only pinch up an inch, you go in at 45 degrees. You use a very small gauge needle, a very short length. So again, it's going to be a small syringe, a small needle. If you use the pre-filled Lovenox, you should not expel the air bubble with the Lovenox. Just an FYI. Different subcutaneous sites are going to be what the diagrams show you here. Again, you're going to go into fatty tissue. You're not going into muscle. The abdomen is going to absorb more rapidly than the thighs. In the abdomen, make sure that you administer your injection at least 2 inches away from the umbilicus. And if they're going to be repetitive injections, make sure that each injection is at least 1 inch away from a previous site. When I administer insulin to a patient, I usually try and administer it in sites that the patient does not have ready access to save those sites for the patient when they're at home administering themselves. To aspirate or not to aspirate. When you're doing a subcutaneous medication, it's not necessary because blood vessels are rare in subcutaneous tissue. Excuse me, or piercing a blood vessel is rare. But you definitely should aspirate with your intramuscular injections. Aspirating after heparin or insulin is definitely not recommended. Your intramuscular sites are going to be faster absorption because they're going directly into the muscle and there is increased blood perfusion in the muscle. You inject at 90 degrees. The sites that you're going to use will be deltoid, ventrogluteal, vastus lateralis, and dorsogluteal. But dorsogluteal basically is not recommended any longer because of the risk of sciatic nerve injury. Complications with IM shots would be abscess formation, sciatic nerve injury, local induration, arrhythmia, persistent pain, hematoma, and bleeding. This is your deltoid site. You find the acromion process, and it will be 3 finger widths below. Your ventrogluteal site, put your hand over the greater trochanter, point your thumb upwards towards the groin, point your index finger towards the anterior superior iliac spine, and point the middle finger along the back along the iliac crest towards the buttock. You will inject in between the V that is formed by your index and middle finger. The vastus lateralis will be 1 hand breadth below the greater trochanter and 1 hand breadth above the knee. How much do you give? Well, it depends on the muscle size. The deltoid is definitely smaller, so they say you can give up to 2 mLs in the deltoid, but I would say 1 ml or less the majority of the time. A well-developed adult, you can give up to 5 mLs in 1 injection in the ventrogluteal. Adolescents, 3 to 5 in an IM. Preschool, 2 to 3. Infants would be less than 1 or 0.5 if they're small. You're going to need a longer needle for an IM injection. You need it to reach the muscle. You use the smallest gauge necessary for the medication that you're drawing up. Average needle length for children is going to be 5/8 to 1 inch, and adults is going to be 1 to 1.5. Occasionally, you'll get someone that requires a longer needle, and adults sometimes require a shorter needle if they're very tiny and don't have much muscle mass. Infants will be injected into the vastus lateralis and the ventrogluteal site, but vastus lateralis is the most common. Children to adults or children to adolescents can be injected in the deltoid and the ventrogluteal also. So again, choose your needle based on muscle size. If you pick up the needle or pick up the muscle between your forefinger and your thumb, you pinch it up. Needle length should be half the distance between the thumb and the finger. That will give you an idea of the right size. Make sure you know your medication that you're injecting. Is there any special instruction, and are there any special side effects that you need to watch out for, such as allergies? Make sure the client is in a comfortable position and encourage them to relax the muscle part. Select the injection site, avoiding bruises, muscle that has been atrophied, or any areas that are infected. Make sure that you have the right needle size. Cleanse the site with an alcohol pad. Go from the center of the site to 5 centimeters out in a circular motion. Place the alcohol pad or cotton or gauze in your non-dominant hand. Remove the needle cap and remove the needle cap with your thumb and the finger of your non-dominant hand. Quickly assess the needle. Make sure that there has been no damage to the needle. Sometimes they get bent. Sometimes there's just issues with the needle. If it's intradermal, you're going to hold the skin very taut with your non-dominant hand. Use your dominant hand over the syringe to guide it. Remember, you're going in at a very small angle, 5 to 15 degrees. Go in approximately 1 inch. You will, for especially very thin-skinned people, see the needle tip. Inject it slowly. Some resistance is okay. Remember, you're just going barely under the skin. Watch for that bleb. Do not massage or place a bandage on it. You may need to draw a circle around the site. If it needs to be checked later, sometimes this is done. Subcutaneous administration. Make sure that you pinch up the skin with your non-dominant hand. You're going to inject in a dart-like motion very quickly. Do not let go of the syringe. Grasp the end of the barrel with the non-dominant hand to stabilize it and inject slowly. Insulin can also be given via an injection pen or medication, an injection pen where you dial up the medication. It has a disposable safety needle that can be attached. You inject and hold for about 10 seconds. These insulin pens are kept refrigerated. With insulin, make sure that you rotate sites to prevent lipohypertrophy or lipoatrophy. With IM administration, pinch up that skin, again holding the syringe between the thumb and index finger, and inject quickly with a dart-like motion. Don't let go of the syringe. You stabilize the syringe, the barrel of the syringe, with your non-dominant hand. Aspirate for blood and then inject. Some IM medications require a Z-track, which means that you're kind of pulling the skin, injecting, and then you're releasing the skin. It helps reduce the leakage of medication into the subcutaneous tissues and minimizes pain or tissue injury. So you're going to pull the skin the same direction as the body. You're going to hold it. This is, of course, after you've cleaned it. Then you're going to inject, allow the medication to disperse for several seconds, withdraw the needle, and then release the skin. When you document, you always document the size, the type of injection, the medication and dosage, and then when you go back to evaluate, you document the response to the medication. Pediatric concerns, they get very anxious. They may have pain. You can apply Imla cream, which is a numbing cream, 1 to 3 hours prior to the injection, or use a vapocoolant spray. Tylenol, Motrin can help afterwards for continued pain. Provide the parents with medication information. Minimize discomfort. By using the smallest needle indicated for the site and solution. Again, change the needle when you can to prevent dullness of the needle or bending of the needle. Inform the client of the procedure, position them, make sure that muscle is relaxed. Insert the needle quickly and smoothly. If you go slowly, it's going to hurt more. Go quick and get it over with. Hold that syringe steady to minimize movement of the needle. Inject slowly. Sometimes lidocaine will be mixed with the medication to help prevent pain. One of the biggest ones that I'm aware of is injecting Rocephin intramuscularly is very uncomfortable, so it's very common to mix it with lidocaine. But you do need doctor's permission in order to do that. When you're teaching your client how to give injections, you need to teach them appropriate technique for insulin and heparin. Make sure that with heparin that it's administered in the love handles, and make sure that you teach them the importance of rotating sites. Very important.